Charlotte City workers are standing tall.
We're fighting for Medicare, Medicare for all. The Charlotte City workers are standing tall.
It's our plan. Protect, improve, and expand. Medicare for all. It's our plan. Protect, improve, and expand.
It's a for-profit industry and is not accessible to most Americans. We need Medicare for all, where everybody has access to health care. We pay it through our taxes like we currently do now.
Well, it's broken. People can't pay their rent, they can't pay for their medications, they go in debt, they lose their homes over catastrophic illness, and something needs to be done. Well, I feel that Medicare for all is the best way to go. It's a single-payer system, and it will benefit everyone, from children to the elderly. I've been talking with my coworkers, I've been talking with my community, I've been talking with different organizations about Medicare for all. And it's spreading like wildfire. Everybody is getting involved and everybody wants to know more. And we need to really push HR 1384 and enact it and make it a real thing.
After many years of having a high quality insurance on my job, I lost my job and I therefore also lost my insurance coverage. At that time, I had a son that had eczema, and we were referred to the Walgreens drugstore to receive some of the cream that he needed to help eradicate the eczema. But due to the fact that I did not have insurance, I could not afford the $900 payment that was required to receive the tube of eczema cream. Therefore, they had to ration the amount for me, and what I did was the lesser amount I could afford, that's the one I had to purchase. And for the first time in my life, I realized how a patient would feel who don't have insurance coverage. Because that was the first time for me for that happening, and it was a real eye-opening experience. And it's something that I would never want another person to endure.
I think we need just a good, solid public system. As citizens of this allegedly great nation, we deserve some sort of health care. And it's not technically a right on anybody's constitution, but it's a human right. And at this point in time, nobody wants to pay attention to human rights anymore. We pay taxes. All of us pay taxes. It shouldn't matter if you work or not. It doesn't matter what you do, you're still going to pay taxes. And if the tax structure was such that the wealthy are taxed based upon what they have, as opposed to us struggling to pay for what we don't have, it would all be covered. So not having insurance for me means that when I call for an appointment to any type of provider, whether it's medical or mental health or some other medical specialty, the second question that is asked is, what kind of insurance do you have? If you don't have insurance, or you have insurance that they consider marginal, that disturbs their profit, then you get pigeonholed. You may be able to be seen on certain days, at certain times, and only a certain number of us can be seen because they don't want to disturb the balance of their profit.
We don't want your stupid wall, we want Medicare for all. We don't want your stupid wall, we want Medicare for all. We don't want your stupid wall, we want Medicare for all. We don't want your stupid wall, we want Medicare for all.
We need Medicare for all. That's bottom line. We need Medicare for all because it's the best available choice. I mean, if you look at all of the studies of most popular healthcare systems in the United States of America, Medicare for all Medicare is at the top. And what Premier Jayapal's bill does is expand on it, makes it better, and provides it to every American over three years. Bernie Sanders' bill does it over 4 years, but basically the same thing. We need one of those bills to pass because we need to join every other nation with a single-payer system, single-payer universal healthcare system. We can pay for it through a variety of ways. I mean, we can do a marginal tax rate, marginal progressive tax rate. We can repeal the Bush-era tax cuts. We can repeal the Trump tax cuts. We can institute a 2% wealth tax. Now, all of these things that I'm saying don't just pay for Medicare for all. These will pay for the whole progressive agenda. That means the Green New Deal. That means ending all the wars, which in fact, ending the wars will take money away from that and put it back into issues that are around social care, helping the people instead of killing people. It's a lot of things that we can do to pay for it, and all of them involve taking money from the rich that they get from our labor and distributing it among the people for their benefit, because health care is a human right.
Fight, fight,